If you spent hours on Google convinced you have an STD, this video may save you months of unnecessary panic. Dr. Yuval Bibi, dermatologist, mission: break you out of the Google skincare matrix and put you firmly back in charge. So you've noticed bumps on your penis and you're convinced you have an STD. You're too embarrassed to tell anyone and resort to endless Google searches. First, you're not alone. There are many men in your situation. Second, seek the advice of a board-certified dermatologist. There are a few upshots to doing this. First, you'll get clarity for better or worse. Second, you'll manage your situation and break yourself out of stagnation. Third, and this is the best part, in many of those situations where you scare yourself half to death, the actual condition is far better than you think. And in many cases, it is not an STI. Let's look at the most common types of bumps on the penis that are often confused for STIs by men, while they are certainly not STIs. Pearly penile papules. These are fairly common skin-colored bumps that appear around the base of the head of the penis, or what's called the corona. They are often confused for warts, but they are actually completely natural. They're not contagious. They're just part of the natural skin in certain men. And there is no need to treat these. Second, Fordyce spots, which appear as tiny yellow bumps on the shaft of the penis. And then there are Tyson's glands, which appear as tiny yellow or white bumps on the foreskin. Again, neither one of those conditions is an STD. See your board-certified dermatologist to clarify. Then there are prominent veins. Certain people mistake prominent veins for an STD or a growth. Again, this can be easily examined, evaluated, and put to rest by our board-certified dermatologist. When it comes to pigment variation, there are a number of reasons why this occurs. The most common one being that pigment variation is actually a normal condition of the skin, including the penis. So you may have a little bit of patchy discoloration on the penis, as in birthmarks or other types of discoloration. This is not necessarily a sign of anything bad happening. But if your pigment variation appeared very suddenly or is dynamically evolving and changing, that's something that definitely needs to be examined immediately by a board-certified dermatologist and the condition from which you're suffering evaluated and managed. The median raphe is a structure that runs on the bottom of the penis. It is a ridge that runs on the bottom of the penis from the head of the penis through the entire shaft and down the scrotum. This can sometimes have little protrusions that are natural that can be mistaken for STIs. Again, see your board-certified dermatologist to clarify. The most common STIs that men experience are genital warts, otherwise known as condyloma acuminatum. Those appear as brown, gray, or pink bumps that are rough or gritty, otherwise known as verrucous. Those may appear pretty quickly, usually appearing over the pubic hair area, especially if you're in the habit of shaving the area. Those may appear over the shaved area, and then those can appear over the shaft as well. They appear usually pretty quickly, and they stick around often for months or years until treated. See your board-certified dermatologist to clarify the situation, as those are a contagious disease and can be transmitted to your sex partners. Also, molluscum contagiosum appears as 1 to 2 millimeter pink umbilicated bumps. Umbilicated means they have a divot or a little depression in the center. Those may also appear over the pubic area, especially if you're in the habit of removing hair, and over the shaft as well. Again, those are an STD, and they must be managed with the help of your board-certified dermatologist. Herpes simplex infection appears as grouped red bumps that turn into vesicles and then sores that can appear anywhere on the skin, including the penis. When they do appear, see your board-certified dermatologist for evaluation and management, as that is, again, a transmissible disease that can be treated, and you must take measures to avoid transmitting it to other people to the best of your ability. Sores on the penis generally must be evaluated promptly by a board-certified dermatologist, as they may be a sign of infection or sometimes even worse, a skin cancer. So if you have a persistent sore on the penis, anywhere on the penis, see your dermatologist for further evaluation and management. Do not be shy about this. Get your house in order and move on. Let me know in the comments section how this video helped you seek help from your board-certified dermatologist and put your situation to rest. Don't go at it alone. You're not. Also, don't forget to share, like, and subscribe for more no BS skincare and medical perspective. See you next time. God bless.